Hi, I'm James Stuckey. In this video, I'm going to be talking to you about the ligaments of the spine. Spinal ligaments are bands of tough, fibrous collagen tissue connecting two or more bones. Spinal ligaments are strongly anchored to the cortical bone of the vertebra and are found in all regions of the spine. They act as restraints and only become active when a joint is stressed to the maximum range of motion. In the neck region, the ligaments are thin. They are thicker in the thoracic region and thickest in the lumbar region. Their marked elasticity serves to preserve the upright posture and assist the vertebral column in resuming it after flexion. A primary spine stabilizer, about 1 inch wide, the anterior longitudinal ligament, or ALL, runs the entire length of the spine from the base of the skull to the sacrum. It connects anteriorly to the vertebral bodies and the discs. The ALL's function is to limit extension of the vertebral column and reinforce the intervertebral disc. Forming the anterior wall of the vertebral foramen, or spinal canal, is the posterior longitudinal ligament, or PLL. It narrows as it travels downward and also has a serrated edge. The PLL's function is to limit flexion of the vertebral column and to reinforce the intervertebral disc. Ossified posterior longitudinal ligament, or OPLL, is a condition in which the flexible structure of the PLL becomes thicker and less flexible. It most commonly occurs in the cervical spine. If the ligament takes up valuable space within the central canal as it thickens, it may compress the neural elements, producing myelopathy and/or radiculopathy. This may require surgical decompression. The supraspinous ligament is a strong fibrous cord that connects together the posterior-most tips of the spinous process from the 7th cervical vertebrae to the sacrum and limits flexion. From vertebra C7 to the skull, the ligament becomes structurally distinct from more caudal parts of the ligament. From here, it is called the nuchal ligament. It helps maintain the upright posture of the head and serves as a midline attachment for some important muscles. The ligamentum flavum is a short but thick ligament that connects the lamina of adjacent vertebra segmentally from C2 to S1. Each arises from the lower half of the anterior surface of the lamina above and attaches to the posterior surface of the upper margin of the lamina below. It resists excess separation of adjacent vertebral lamina and, because of its elasticity, prevents buckling of the ligament into the spinal canal during extension, which would cause canal compression. The interspinous ligament is composed of thin sheets connecting the spinous processes from C1 to S1, one segment at a time. That is, it is a segmental, not longitudinal ligament. Anteriorly, its fibers connect with the ligamentum flavum, while posteriorly, its fibers connect with the supraspinous ligament. The role of the interspinous ligament is to limit flexion through restricting separation of the spinous processes. The intertransverse ligaments are segmental ligaments located between the transverse processes of the spine. In the cervical region, they consist of few, irregular, scattered fibers that are often replaced by muscles. In the thoracic region, they are rounded cords intimately connected with the deep muscles of the back. And in the lumbar region, they are thin and membranous. The function of the intertransverse ligaments is to limit lateral bending of the spine. The costotransverse ligament is a short fibrous band that segmentally connects a rib with the transverse process of that vertebra. It supports and prevents dislocation of the ribs. And that's it. You now know about the ligaments of the spine.